Hi, everybody. Today we're going to be going over gender dysphoria. The group consists of Alondra Ramirez, myself, Fabian Juarez, Jeffrey Rucker, and Tiffany Otherby. This is our presentation for week six, sex therapy course. So I'm going to start out off with etiology of gender dysphoria. Just want to give out a little definition. I don't know about you guys, but I personally, when kind of digging into this topic, was very confused with all the terminology. So just having a definition out there for me made things a little easier and clear for me to understand. So, in terms of gender dysphoria, this is the clinically significant distress or impairment that may occur when a person's experiences or expresses gender differs from the sex assigned at birth. Not all transgender or gender diverse individuals experience gender dysphoria. There's some possible causes for gender dysphoria, some things such as biological factors, psychological factors, and social and environmental factors. And I have some written down here that I'm going to go over. In terms of biological factors, we have genetic influences and prenatal hormone exposure, as well as differences in brain development related to gender identity, which this is still under investigation and research still needs to be done. But that is something to keep in mind that could be a possibility. For psychological factors, we have development of gender identity during childhood and individual emotional and cognitive development. And for social environmental factors, we have family support or rejection, peer relationships, cultural and social expectations regarding gender, and experiences of stigma, discrimination, or minority stress. In addition, a note that I kind of wanted to add to this slide or presentation is that gender dysphoria is not considered a mental illness caused by parenting, trauma, or personal choices. The exact etiology remains multifactorial and is still being studied. Moving on to systemic assessments, for comprehensive history, there's a couple of things we can gather, such as gender, medical and mental health history, sexual, psychosocial, patient goals, and safety. And what those look like are, for example, gender history could be anything such as like gender identity development, onset, duration, and severity of dysphoria, social transitions, which includes name, pronouns, and clothing, to name a few, and previous gender affirming treatments. As for medical and mental history, these could be past medical and surgical history, mental health history, such as depression, anxiety, or suicidality, and any current medication and substance use. For sexual and reproductive health, it could be sexual history, fertility goals and reproductive history, and contraceptions and STI screenings when appropriate. Psychosocial assessments are family and social support, relationship and living situation, school or and work environment, and experiences of stigma or discrimination. And lastly, for patient goals and safety, we have goals for gender affirmation care, expectations and information decision making, and suicide risk and overall safety. In terms of questionnaires and tools, there's a couple questionnaires that can be used when kind of dealing with gender dysphoria. One of those would be Gender Preoccupation and Stability Questionnaire, which assesses gender-related distress and preoccupation. We have Gender Identity, Gender Dysphoria Questionnaire for adolescents and adults. This one measures the presence of severity of gender dysphoria. And the last one is a Uterized Gender Dysphoria Scale, which evaluates gender dysphoria symptoms. I also added the PHQ-9 for depression and GAD-7 for anxiety, these are probably symptoms that people dealing with dysphoria, gender dysphoria might be experiencing. As for clinical assessments, we have evaluate psychosocial functioning, assess safety, including risk and self-harm, identify coexisting mental and physical health conditions, and determining readiness and goals for gender affirmation care using individualized multidisciplinary approach. Now I'm going to pass it on to Tiffany to continue with our presentation.
Thank you. So, in the DSM, we distinguish a diagnosis between children and adolescents and adults. So, again, an incongruence between one's experienced or expressed gender assignment at birth. And this is going to be for at least 6 months. And for children, we're going to want to look at six of the following criteria to be met, as well as presenting significant social or educational functioning. A lot of the diagnosis criteria for children involves play and clothes and pretend, but also a strong dislike for their own anatomy and to a desire to have the primary or secondary characteristics of another gender. And moving on to the adolescent and adult diagnosis, same sort of idea, again, for at least 6 months. and at least two of the following criteria. So, two for adults and adolescents versus six for children. And this has less to do with play and more a desire to be treated as the opposite gender, a desire to be rid of the secondary sex characteristics, and a conviction that their emotions, affect, reactions are that of the opposite gender, as in they are acting in a way of the opposite gender. And of course, the above two, any above two, and presenting significant or social occupational functioning. Some specifiers that you want to see in the next slide are in children or adults, we want to specify if this is co-occurring with any disorder of sex development, such as anything congenital or androgen insensitivity. Androgen insensitivity is a person born with XY chromosomes. So this would be some genetic testing, but as they develop, through puberty, their phenotype, the way that they look, is female. And then the second specifier in adults would be to specify if they have transitioned either full time in a cultural sort of way or has undergone any gender affirming medical procedures such as surgery or hormone therapy.
Okay, and now to follow on with this, I'd like to bring up some of the biological considerations that our group has talked about with gender dysphoria. And really want to stress from the beginning that this is a field where we're still researching and still learning. However, what we have come across so far with genetics is that there is some influence of genetics in gender. There has been some studies with twins, with both um, identical and fraternal twins, and it does show that there is a slightly higher occurrence of gene duplication and with genetic twins, I'm sorry, with identical twins. But there really hasn't been anything identified yet that shows there is one specific gene that can trigger or start gender dysphoria. Brain structure and neuroanatomy is also something that's been researched. And what we found so far is that there's really not much of a difference in brain structure, but how the brain develops is where we're starting to find the nuances and the differences. And different genders will have neurological growth at different phases and at different ages. And so that's one thing to keep in mind is when someone transitions from one gender to another over their lifespan, there may be some obstacles, there may be some holes that they will need to learn or to adapt as they're transitioning. Next slide, please. Also, we want to keep in mind that, hormones have a lot to do with how we grow and the stimulation that happens in our brains. And we have discovered that there are some variations in the receptor sensitivity within the brain, with how different brains will react in different stages. And then also, just to keep in mind that current research suggests that gender dysphoria is influenced by multiple factors, both biological and nothing really from a single cause. Genetics, prenatal hormones, brain development, neuroanatomy. Those are just a few of some of the things that can influence gender dysphoria, and science is still researching to get a better understanding as to how and why gender dysphoria may occur and how we can better support people while they're transitioning. Thank you.
Okay, so for treatment prognosis, the prognosis for treating gender dysphoria is highly positive with both medical and psychotherapy interventions. Some medical treatments, common ones are like how Jeffrey stated, hormone therapy. And this really does help, or there has been scientific research that it helps with reducing psychological stress and even improves a person's quality of life. As for psychotherapy interventions, I may come off a little biased because my form or my therapy model is narrative therapy. And I found that narrative therapy interventions, such as deconstructing the narrative or a person's narrative, as well as reauthoring their story, can help a lot in this transition. And there's also been positive outcomes such as reducing the psychological distress and making the person feel authentic to themselves. But also, as many may already assume, like psychotherapy does help people and providing them that support that they may lack in some areas in their life. But yeah, next slide, please. Current research. So there has been really interesting. I had a lot of fun doing this. So there's 0.6% of Americans experience gender dysphoria. An important focus is, or an important find in research that I found was that there's a range of biological and environmental factors that contribute to this diagnosis. For example, there's genetics and prenatal hormone exposure. However, there is no specific gene that has been identified as the sole cause of gender dysphoria. Of course, there's still research being done on this, so who knows what will be found in the near future. And there has been also recent revisions in the clinical terminology and definition surrounding this diagnosis. In in 2012, I want to say, no, sorry, 2013, gender dysphoria was introduced. Back then, it used to be known as gender identity disorder. And another thing that I found within current research is that the professionals authorized to assess individuals for this diagnosis changed. Any healthcare provider equipped with appropriate training and capable of assessing gender dysphoria is allowed to hand out that diagnosis. Last but not least, 51 scholarly articles found that transitioning in any way that a person feels most comfortable, be that socially or medically, can contribute to a better quality of life. For example, these better quality of lives can be found in relationship satisfaction, reduction in anxiety, depression, suicidality, and substance use. Overall, although this is current research, I am hopeful that we as professionals, well, maybe not myself, but professionals continue to do ongoing studies for gender dysphoria.
Thank you, Alondra. Sorry, I was on mute. So I just wanted to touch quickly on this map of studies about gender diverse cultures. This is a study from PBS, and they put together this map of countries in the world that recognize, and I'm sure there are more countries and cultures that recognize more than one or more than two genders. So if we can go to the next slide. The bullet points, the smaller bullet points are the names that are given to third gender, fourth gender, fifth gender folks in these countries. Like I said, there are more, but I just thought it was really interesting that so many places had, a word for this, that it seems like in the debate culturally in America, there's not a lot of consideration of what goes on around the world. I wanted to note that in many of these countries that were colonized by Western countries, the mission was also to convert to Christianity. And in Western Christianity, the question of how many genders there are is often answered in just a binary, and thus creating prejudice and a tool of exclusion and violence. In many of these countries and societies and cultures that I've presented the map for, their gender non-conforming individuals were often tasked with spiritual and religious functions for the group, thus being a target for the Western Christianity. A note for the LGBTQI plus community is that they recently, in 1990, it hasn't been seen very much. It's like just starting to sort of enter into the zeitgeist. This 2S at the front of the LGBTQ stands for two spirit. And it's important to know that this is considered a term only for those in the First Nation or those who are Native Americans, and that it's considered cultural appropriation to use that two-spirit if you are referring to yourself as transgender and not of the First Nation. The last slide that I have is a PDF file that can be found. It's very widely available. This is the flying gender unicorn, which was added onto the gender unicorn from the trans student educational resources. And this Dr. Erica Friedman has added on not just gender identity or gender expression, but also orientation and romantic identity, who you can be physically attracted to, as well as external genitalia, hormone, and chromosomes. This is a really great worksheet to go over with somebody that's questioning, and all of the sort of answers that one would find in using this are on a spectrum. And the PDF is available online as well.
Awesome. Thank you, Tiffany. I think that brings us up to the end of our presentation. I hope you guys enjoyed, and thank you so much.
Thank you.